Now, we would like to also talk a little bit about what happens when dealing with more than one type of respondent as part of your survey. It is extremely important to decide who you will interview in your survey. And for the community health projects that we are involved in, there are different types of groups that we want to interview. The typical grouping of people can be summarized in this particular table. For the type of projects and the type of interventions that we do, one grouping would be women between the age of 15 and 49 years of age for projects that include interventions of HIV/AIDS or STIs, as well as for safe motherhood and reproductive health. We also may find in many times a particular group of women between 15 and 49 years of age who are not pregnant, and those will be more suitable for family planning interventions. We would also have cases where we have men between 15 and 49 or between the age of 15 and 54 that would be more suitable for interventions that will include HIV/AIDS and STIs, as well as family planning interventions. We could also have a grouping of mothers with children 0 to 11 months of age, and those will be more appropriate for the type of interventions that include antenatal care, interpartum, postnatal care, newborn care, as well as probably child growth monitoring. We could also have another grouping of mothers of children within the age of 12 to 23 months, and those will be more appropriate for projects that include child growth monitoring again, and perhaps immunization as well. So the previous table was mostly the type of grouping that the projects that we're all involved could present, and with some examples of the type of projects and the type of interventions that will be related to these particular groupings. In order to introduce the concept of parallel sampling, we would like to highlight for you three main issues. The first one, some programs may have a variety of indicators whose denominators are different from each other. Therefore, if that is the case, you're going to need to interview more than one type of respondent. And for the child survival projects that we are all involved, we interview usually at least two groupings, and those are mothers of children with age of 0 to 11 months, as well as mothers of children aged 12 to 23 months. So if that is the scenario, it is better to interview two samples rather than to interview one sample of mothers of children aged 0 to 23 months. To give you an example of how parallel sampling works, we would like to present a couple of one scenario. In this case, the type of interventions that you see in your left-hand side under included in the blue box, and the type of survey questionnaires that we would use in the box with the yellow shade. We have, assuming that we have 5 particular interventions, then we would select specific survey questionnaires to use. For this particular example, if we have an intervention that includes antenatal care, we will use a survey questionnaire for mothers with children 0 to 11. If we have an intervention of newborn care, we will also include those questions in the survey tool designed for mothers with children 0 to 11. If we have an immunization intervention, more suitable would be to include those questions for the survey tool designed for mothers with children 12 to 23 months of age. If we have a diarrhea case management intervention, we would like to include questions for these interventions in both type of questionnaires. the mothers with children 0 to 11, as well as the survey tool designed for mothers with children 12 to 23 months of age. And lastly, if the project has a family planning intervention, we would prepare a survey questionnaire for women between the age of 15 and 49 years old who are not pregnant. So by having all these different survey questionnaires, one for mothers with children 0 to 11 months, then another one for mothers with children 12 to 23, and then another one for women 15 to 49 years old who are not pregnant. By using these 3 questionnaires, that includes some scenarios that we will explain in the next slide in terms of how to do the sampling in those selected communities and in those selected households. We would like to summarize these steps when using parallel sampling. First, you go to each community where you have to take one of the 19 LQAS samples. You will randomly select one household in the community by doing the same process that we have explained earlier before in this lecture. Then if a woman between the age of 15 and 49 lives there, then use the woman's questionnaire in that particular household. If there is either a mother of a child 0 to 11 months of age, then use that questionnaire for mothers with children 0 to 11 in that particular household too. If there is no mother with a child in this age group, then go to the next nearest house. You're going to continue going to the next nearest house until all 3 questionnaires have been used. We recommend not to sample a mother of a child 0 to 11 months and a mother of a child 12 to 23 months in the same household. The main reason is that because you're assessing mothers' treatment of their sick children, you have to be sure that all of your mothers live in different households. Mothers who live in the same household may treat their child in the same way. Therefore, it is better to always sample mothers of children who live in different households. We're going to talk and explain further about this particular scenario when using parallel sampling in our live session a week from today, scheduled on March 1st. In the next lecture, lecture number 3, we will address in detail how to analyze data, including examples with parallel sampling of different groups. That brings to the closing of this lecture number 2. Once again, we take the opportunity to invite you and your colleagues based either at headquarters or in the field to join us on March 1st, 2006, when we will have a live interactive session on the internet using the Illuminate tool. This live session will give you and your colleagues the opportunity to ask questions related to selecting communities, selecting houses randomly, as well as how to use the parallel sampling approach when trying to address different types of respondents. We advise you that registration is required to attend this live session scheduled for Wednesday, March 1st, 2006. You can register at the core group registration page on the website at the link provided in this particular slide. For recorded sessions and updated schedules of upcoming lectures, please visit this particular link located here at the bottom of this slide. Once again, on behalf of the M&E Working Group from CORE, we thank you for your attention, and we look forward to talking to you live on the internet on Wednesday, March 1st, starting at 10 a.m. U.S. Eastern Time. Thank you.